a decade of life, which is incredible.
A smoker's lifespan, new research shows big benefits for kicking the habit and serious consequences for those who don't. Welcome back to 10 News at 5. I'm Beth Haynes. An estimated 40 million Americans smoke. According to the CDC, smoking is to blame for about 1 in 5 deaths each year. New research out this month gives insight into smoking's impact and the benefits of quitting. Researchers found smoking shortens people's lifespans by at least 10 years. On the flip side, however, people who quit smoking before they're over the hill reduce their risk. People can expect to gain about 9 years back compared with those who keep smoking. And it also shows women face just as high a risk of smoking as men do. That is an increase from 1980s research. Well, for more insight on this study, we are joined now by John Dalton with Park West Cardiopulmonary Wellness and Rehabilitation Center. You're the manager there. We appreciate you being with us and talking about this study. And it's not a new concept that smoking takes years off a person's life. We've heard that quite a bit. But this research really highlights the positive side, what you can gain from quitting the habit. Are the benefits bigger than previously thought?
I think so. Well, I will say that the benefits may not be larger, but they're more prevalent. We're more aware of those benefits because of this large study. This is one of the largest studies that has been done, especially in women. Yeah. I think you alluded to the fact that it was a change in a 1980 study that was done in females, but this is a much longer study, and this study is much more in depth in females than the one in 1980s.
Okay. Well, it is encouraging and kind of a different spin than we've heard in the past. How do you think it's going to impact people that are debating whether or not to quit smoking?
Well, first of all, most of the research will tell you also that the people that are finally successful with stop smoking, it usually takes multiple attempts. On average, 3, 4, maybe even 5 attempts. I think it should be encouraging to those people that have tried and have relapsed to keep trying, because as this study points out, the benefits are enormous in terms of the quantity of life, which that's the headline in this article about, you literally get years back in your life, 10 years, 9 years. But I think even a step further than that, actually quality of life. The work that I do in cardiac and pulmonary rehab, we see a lot of people, of course, in the pulmonary rehab and the cardiac side as well, that it's not always about quantity, but quality of life. And I think that's important to look at as well.
Let's talk about how smoking impacts a person's lifespan.
Well, first of all, smoking tends to be associated with other unhealthy habits, such as lack of exercise, poor diet, poor management of stress. Also, one of the things to also always pay attention to is your ability to exercise, or your exertion level, be able to move and do normal activities around the house is going to be limited as you continue to smoke. That's certainly going to be limited.
I want to make sure that we're clear. This study is not saying to continue smoking until you're 40, and then if you quit, they're really encouraging you to quit sooner than that, right?
Absolutely. They're encouraging you to quit as soon as possible, and that's very important. If you look in the state of Tennessee, incidentally, Tennessee ranks 45th or worse in just about every category in smoking. And if you look specifically at the benefits of smoking cessation, the first thing you're going to see is an increased ability to exert and to move and increase your activity level. You're going to have decreased blood pressure, decreased risk of stroke, and decreased risk of lung disease. So those things are very important to key on, and this study just confirms and supports that evidence. I think also if you look at the age population, most smokers are less than 40. Matter of fact, the majority of smokers start before they're 18 years of age. I think it's all the more important for the majority of smokers out there to know that sooner is better in terms of stopping.
You mentioned the new information in terms of women. Does smoking impact a female body differently from the male body, or the same issues?
I think it's the same issues. I think, though, that we're more aware of those issues being equal now than we have ever been before, because of our ability to be able to study the female, because it's just probably since the 1960s or 70s where females really started taking up smoking, and it started being looked at and being studied.
Now, a lot of people perhaps try to quit, not always easy for everybody. What are some resources out there that can help people through the process?
Well, there's several resources just in our area. One of which in Covenant Health, we have the Freedom from Smoking classes that are a hands-on classroom environment. You can call 865-374-PARK, and they can ask you about those Freedom from Smoking classes and give you some information about that, enroll you. Also, we actually just launched a new Stop Smoking app with Covenant Health, which is doing quite well over the last few weeks. We've had several downloads, over 500 downloads, so that's doing well.
Does it just help the smoker, or does it hold them accountable?
It holds them accountable, which is very important. It holds them accountable. It will definitely track their triggers and find out what time of day am I smoking, what activities are surrounding my cravings, and that's very important to identify.
All right, John Dalton, thank you so much for being on our show today. We appreciate it.
Thank you.
All right. Well, ahead at 5.